In this video, we will show how the monitor alarms you when vital signs are deteriorating and how you should respond to an alarm. The monitor is able to provide two types of alarms. The first type are the technical alarms, which warns that a sensor cannot measure a vital sign. These alarms are shown as a block on the vital sign with an explanation of the alarm. For example, ECG lead off or cuff loose or no cuff. The second type are the physiological alarms. These alarms start when a patient's vital signs get higher or lower than a set alarm limit. For example, when a patient heart rate goes too high. These alarms start as priority alarms, indicating that a patient should be checked promptly. Priority alarms can be recognized by the vital being highlighted in yellow, a blinking yellow light at the top, and it sounds like this. When a vital goes into a critical range, then the alarm escalates to an emergency alarm, which indicates that a patient might be in a critical state and that immediate response is required. For example, when a patient has a critically low oxygen saturation. Emergency alarms can be recognized by the vital being highlighted in red, a blinking red light at the top, and it sounds like this. When multiple alarms are active, the most important alarm is audible. Like here. The patient has a high heart rate and a critically low oxygen saturation. So you hear the emergency alarm. In most settings, the monitor will have an alarm delay, meaning that the system waits for a few seconds before it starts to make sound to reduce the number of false alarms. When you hear or see an alarm, you have to go to the patient to look for the cause of the alarm and to check if the patient needs immediate intervention. You click on the alarm pause button to stop the sound for the next few minutes. This allows you to act without noise from the monitor. By checking the waveforms, you can see if the measurement is accurate or if it might be a false alarm. It should never be assumed it is a false alarm without actually assessing the situation of the patient. You should check the patient's condition for emergency signs and act accordingly. When you've responded to the situation and you accept the current alarming vital sign, then you can acknowledge the alarm. This silences the alarm while the alarm condition of the patient stays the same. Muting the alarms is important as this prevents too much sound in the ward. It also helps you to hear new alarms. But make sure that the alarm situation is always reacted to and that it is not forgotten.